Miss Hernan, my name is Casey. I'm going to be your nurse today. Can you tell me what brought you in?
I've been having a really sore throat for the past few days.
Okay. Can you tell me what that sore throat feels like?
It's just this pain going up, and it kind of radiates to my ears almost.
Okay, so it's radiating to your ears. Is it like a burning feeling, throbbing?
It's more like a burning.
Okay. Is it, besides radiating to your ears, is it radiating anywhere else?
No.
Okay. Can you tell me when this started to happen?
Like 3 to 4 days ago.
Okay. Are you doing anything to make the sore throat better or to make it worse?
I've been taking some throat lozenges.
Okay, and that makes it better when you do that?
It makes it a little bit better.
How long does that last for when you take that?
Not long, like 10 minutes.
Okay. Can you tell me on a scale of 0 to 10, 0 being no pain, 10 being the worst pain, how bad is this pain for you?
It's about a 6.
About a 6. Okay. When is this pain the worst during the day?
Probably when I wake up in the mornings.
Okay, when you wake up. By the time you go to bed, does the pain go away or no?
Just a little bit, but still not really.
Okay. Can you tell me about your past medical history?
Well, I broke my ankle about 8 months ago.
Okay, you broke your ankle. Do you have any family history of heart disease, anything, diabetes, anything?
No, not really.
Okay, are you allergic to anything?
No.
Are you on any medications?
Not currently.
Not currently. Okay. Have you had any surgeries, operations recently?
No.
No. Okay. And what do you think your sore throat could be? Have you ever had strep throat?
I think it could be maybe strep throat.
You think it may be? Good. Okay. Have you ever had strep throat before?
Yes.
Okay. How long ago was that?
When I was younger, like 10 or 11.
Okay. Do you remember what it feels like? Does that feel like this? Okay, great. Thank you. We're going to take your height and weight. So I'm going to have you stand up. We're going to start with height, which is over in this corner. I'm going to have you take off your shoes, if that's okay. And then I'm going to have you stand against the wall. Just lean your head back. Yeah, perfect. Okay. Now I'm looking at the inches, and at the top of her head, which is 68 inches, which is 5'8". Is that normal for you?
Yes. Okay,
great. So that's a normal range. And then next I'm going to have you stand on the scale, again with your shoes off. So when you stand on the scale, perfect. Okay. And that is also a normal range, so thank you. You may step off and have a seat. Now the next part of my assessment, I would go and wash my hands before I started with the physical assessment. When I wash my hands, I'm going to use warm water and soap, and I'm going to wash my hands for 2 happy birthdays or 30 seconds. And I want to make sure that I get in all the crevices and make sure I get everything off my hands. It is possible for you to use hand sanitizer when you don't have any gunk on your hands as well. And then I would move on to temperature. So, Ms. Cernan, I'm going to take your temperature now, and I'm just going to have you stick this right under your tongue for me. So the normal range for our temperature is 96 to 99. And the best place to do this would be your ear, but it is possible to do it under your tongue as well. Okay, and I'm going to listen for the beep, and I heard it, and your temperature is 98.6, which is perfect, and that is actually the golden standard. And I'm going to take your pulse. So when I take a pulse, I am going right below the thumb in between the 2 bones, and this is called the radial pulse. I'm going to press down firmly and then release up until I feel the beat. Okay, so even though I took your pulse for a minute, I really only did it for 30 seconds. And when I was doing that, I was looking at your rate, your rhythm, your force, and elasticity. So for your rate, it was 72. The range is about 60 to 100, and the golden standard is 80. So that was regular.
Okay.
When I looked at I looked at the rhythm, you want it to be the same tempo. So you want it to be dun 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 dun, which it was, which is wonderful. And then I looked at your fours, and you want to make sure your it's hard pulls and not too thready, and that was about a +2, which is normal. The range is +1 to +4, so that was great. And then I look at your elasticity. So I wanted your pulse not to be too stiff. You want it to be bouncy when I press down, and a little spongy, which it was, which is great. So everything was regular for your pulse. Your pulse for 30 seconds. So as I was still resting my hand on your radial pulse, for the extra 30 seconds, I was looking at your respirations. So when I was looking at your respirations, I was looking at how you're breathing. I wanted to make sure that you were breathing equally, which is called your systematic expansion, to make sure your chest was equally rising and falling. And I was also looking at your positioning. So I wanted to make sure that you weren't using any accessory muscles, that you were in a tripod position. And then for your normal range is between 10 and 20. The golden standard is about 18, and you're about 14, which is perfectly normal. Okay, Miss Herndon, so now we're going to go on to the final part of my assessment, and I'm going to do your blood pressure. So I'm going to have you rest your hand on the desk, and I'm going to have you have your hand down. I'm going to make sure that your positioning is correct. So no legs crossed, feet on the ground, and I want to make sure you're sitting up straight. And I want your hand to be at heart level also when I'm taking blood pressures. So regarding the cuff, I wanted the cuff to be 60% of Miss Herndon's arm. And there's different cuff sizes depending on the particular individual. So when I do this, I want to make sure that I have the artery facing downwards, and I wanted to place it right on the brachial artery. When I go around, I wanted to cover 80% of the Velcro. And if it's not, that could give you an inaccurate reading. I also want to make sure that I do 2 fingers up from where your arm bends. So now I'm going to take her blood pressure, and
No, it's fine.
Okay. For this, I would usually use the bell, and that's what textbook says. But for this purpose, I'm going to use the diaphragm. So I'm going to listen to the pulse when I start pumping, and then when I don't feel pulse anymore, I'm going to continue going up 20 to 30 numbers higher, and then start to listen for your blood pressure. And I want to, then when I start to release, I want to listen for the first bump, which is your systolic, and then bump, 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 and then when you don't hear anymore, which would be your diastolic number. Place this here. I don't hear anymore, so I'm going to go up 20 to 30 higher and start to release. Okay, great. So your blood pressure was 102/72, which I think is normal for you. I heard that you sometimes have low blood pressure. But sorry, I gotta take this off of you. So for blood pressure, the golden standard is 120/80. So as long as you're in the normal range, that's okay. And especially if that's normal for you, that would be good. Okay, so that will finish up my assessment. Thank you.